after breastfeeding, is it better to wait 6 or 12 months before considering breast surgery? Well, this goes down, I would say, to the word better. Better for who? So better for me is longer. The longer the better. So 12 months is better than 6 months, if you ask me. The longer you leave it, the better, for a couple of reasons. Number one reason, your breasts have to recover after breastfeeding. And so the longer you give them to recover, the better, to see where we're going to be, to see where we are with volume, with shape. The skin might retract, the size might change. So if we want to see where we really want to be operating on a stable platform. So the longer it's stable, the better. So from a surgical point of view, 12 months is better than 6. However, sometimes I think 6 is kind of widely regarded as being kind of minimum, because you need the breast needs to settle. I think 3 to 6 is kind of like the sort of standard, because the breast needs to settle and you need to settle, and also you've got a newborn baby presumably if you're breastfeeding, so you need to take that into account. But sometimes patients want to have surgeries before 12 months because maternity leave is 12 months. So I can completely understand that you don't want to take 12 months off maternity leave, go back to work, and then say, can I have another month off because I'm having some kind of breast surgery. So I completely understand why people want it within the 12 months, so maybe like 10 months or something. So it's not written in stone. I think it's kind of okay to do it at 6 months if things seem to be settling, but the longer you leave it, the better. So if you ask me, I would always go up to the 12-month end of things. The longer the better. But I completely understand why some people say, look, you know what, I've got 12 months off, I'm going back to work in whenever, I'm in my mind, I've got it all planned and I want to have it done in, maybe 10 months post breastfeeding or whatever. So it's kind of something you need to sort of think about and weigh up in your own mind as to whether that's when the good time for you is. So and we will work with you, partnership, right? It's together. We're not against each other. We want to get the best result for you. And as I say, I can say you've got to wait 12 months, but you might say, well, look, you know what? It really suit me to have it done in, September or February or whatever. And we're like, okay, well, that's 10 months. Yeah, all right, we'll do that then. I would be like, well, it might be better to wait another couple more months because things might settle. And you might say, well, I don't think they will. Well, okay, it's your body. If you don't think you will, that's fine. The only thing is if you do surgery now and they do settle, they do get some, you use implants or something like that, and they get smaller, then you might want it a bit. So, you want to get the best. We both want the best result, and so we're just trying to get the best result. So, yeah. So that's where I am on the breastfeeding question.